guys, it's me, Gallimore here. I'm going to tell you about my book, So You Think You Can Check, the Retina Patient Workup. This book serves as a pocket guide to retina technicians that includes a variety of helpful charts, tables, and a list to aid in their daily duties. My years of experience are sure to provide some insightful tips to make sure that you are performing at the highest level. That being said, let's dive in. A quick disclaimer, it is important to understand this book is used to provide useful and guiding advice, but in no way, shape, or form gives medical advice, only references helpful information to point you in the right direction. Don't abuse the information, always consult with your doctor. Chapter 1, Understanding the Beauty of the Globe, Basic Anatomy and Physiology of the Eye. In the first chapter, we understand and review the eye's basic anatomy. We go over the cornea, pupil, iris, retina, and learn how they all work together to give us the amazing gift of sight. The cornea alone is extremely complex and includes 5 layers. They are the epithelium, the Bowman's membrane, the stroma, descemet membrane, the endothelium. We also learn about the iris and how it decreases the diameter of the pupil to limit the amount of light that reaches the back of the eye. The sclera contains collagen and forms the optic sheath around the optic nerve. The lens has 3 layers, the capsule, the cortex, and the nucleus. They work together to help round out light and focus on objects. The eye is a very complex part of the body, and to properly understand it, it is important to understand the mechanics. Chapter 2, the retina's got some nerve, common optic nerve and neuro-ophthalmologic disorders. The retina is the most important tissue in the nervous system. While working up a retina patient, other neurological problems may be present. These include 3rd nerve palsy, 4th nerve palsy, 6th nerve palsy, glaucoma, optic atrophy, ischemic optic neuropathy, disc edema, and many more. To be a better technician, you must understand basic problems within the optic nerve. In Chapter 2, we discuss the most common issues and how we go about treating them. Chapter 3, Let's Get Bloody, Understanding the Eye's Blood Supply. The eye keeps itself healthy through absorbing nutrients and eliminating waste products, like the rest of our body does. It does so through the circulatory system. Red blood cells carry oxygen to all other cells in our body. Then they carry CO2 back to the lungs, where it's then exhaled. White blood cells functions as the first line of defense for our immune system. They seek out to bind to foreign proteins, viruses, and bacteria. Plasma makes up our blood and carries nutrients to the tissues of the body for various purposes. It also aids in removing waste. Lymph. It is an important part of the body's cleansing system, and it collects waste within the tissues as they pass through lymph nodes. Lymph nodes are tissue masses that act as collection centers and filters. Platelets release chemicals to cause clots at the wound sites and prevent excessive blood loss. They also lead to healing with oxygenated blood. Chapter 3 focuses on each component of the circulatory system and how the proper blood flow aids in healthy function of the eye. Chapter 4, Nature versus Nurture, a review of disease and causation. In our next chapter, we focus on what causes all retinal disorders. The understanding of systemic diseases that affect the circulatory system are covered, including hypertension, diabetes mellitus, and hyperlipidemia. I know those are a mouthful, but as a tech, you need to be prepared to not only say these diseases, but explain them. Some of these include diabetes, the lead cause of blindness in patients under 65 years of age. High blood sugar causes insulin buildup in the retinal capillaries. This can result in poor oxygenation of the retina. Hypertension. Blood pressure increases with age, and it is associated with reduced elasticity of the blood vessels. This loss increases pressure in the vessels when the heart pumps. This is associated with leakage in the retina, which can cause cloudy vision and eventually blindness. Hypercholesterolemia. High cholesterol comes from poor diet, obesity, or genetics. Cholesterol sticks to the walls of blood vessels, which can block the path to the retinal arteries, causing vision loss. Chapter 4 goes over the causes and effects of these disorders. It is important to be well versed on them. Chapter 5, getting old sucks, common retinal disorders caused by the systemic diseases. As patients age, it is natural to see varying levels of regression. Many of these come from systemic diseases. Some of these diseases are retinal artery occlusion, blockage of the oxygen-containing arteries from a blood clot, embolus, or inflammation. This occurs when plaques lock themselves in the retinal artery and disrupt blood flow by causing more clots. Retinal vein occlusion, also known as RVO, is blockage caused by one of the small veins that carries blood away from the retina. These clots can detach and become mobile while moving through the bloodstream. This causes the risk of lodging into other vessels. Retinal breaks. Retinal breaks can be tears or holes. Mostly, they are located in the peripheral retina, so this requires use of an indirect ophthalmoscopy. This can also lead to retinal detachment and a macular hole, which can cause several central vision loss. There are strong links to the eye from these conditions, and in Chapter 5, we cover the localization, prep, and treatment of these and more. In Chapter 6, we explain all about the immune system. Get ready for another list because there are a variety of infectious diseases that can inhibit the function of the eye. It is important that all techs are familiar with them. Acute retinal necrosis, ARN, affects the posterior part of the retina. They require careful clinical examination. Toxoplasmosis. This condition is caused by the Toxoplasma gondii parasite. It is a feline STI that can spread to humans through poorly cooked meat or contact with cat feces. Behçet's disease. Behçet's disease is categorized by recurrent ulcers on the retina, mouth, or genitals. Hereditary involvement may also play a role. Tuberculosis, TB. It's expected after an unsuccessful treatment of prolonged uveitis. Diagnostic tests are usually required. Acute neuroretinitis, ANR, is disturbance of the retina, both bilateral and unilateral. It follows a viral infection that leads to distortion of vision, including metamorphosia. All of these, their variations, are covered in Chapter 6, and we discuss how to tackle them. Chapter 7. New drugs are only for those who can afford them. Pharmacology and ophthalmology. It is critical for technicians to have working knowledge of the most commonly prescribed ocular medications. With so many changes in technology and research, we go over the most important updates and advancements in the ocular field today. These drugs are constantly altering our field of work, so it is important to be familiar with them. Chapter 7 tables include indications, side effects, and contraindications of all of these, as well as steroids and antivirals. Keep these tables at the ready and in your mind to be the best technician you can possibly be. Chapter 8 keep it short and sweet. Ophthalmic terminology with abbreviations. Do you speak retina? Chapter 8 goes over the ABCs. Get ready for another list. Here are some examples. ACG, AION, AMD, BH, BRAO, BRBO, and there are so many more. These abbreviations are crucial for you to know to make your day easier for yourself, your doctor, and all the staff. Chapter 9, shooting retinas, pattern recognition in retinal angiography and optical coherence tomography. Pattern recognition skills are crucial to taking good photos of the retina. Chapter 9 includes an extensive gallery of many of the common patterns you will see as a tech. In addition, it also goes over how you can get the best shots to help facilitate proper diagnosis and treatment. Chapter 9 includes extensive diagrams of the early phase, the mid phase, the late phase, the shady red spot, and more. Chapter 10, rolling up your sleeves. Practical skills of the Super Retina Tech. Chapter 10 includes some of the most helpful tips, pointers, and vetting processes tests can use to give patients the best experience possible. There are a variety of things I have learned during my time in the field, and I condense a great deal of this knowledge in this last and final chapter. Organization of history. It is greatly important to have charts and health history divided into easy to utilize sections. As a tech, you have the responsibility to obtain an accurate medical and ocular reading and history. This book was designed to make the complex tasks you have as a retina technician seem more natural and comfortable. It is your job to make the doctor's duties run as smooth and seamless as possible. As always, continue to expand your base of knowledge and keep up to date with the latest developments and protocols. Our health is our wealth. And as always, your wellness is my mission. Thank you.